I like to unfortunately refer to the problems going on in the pelvic area as kind of the medical black box, because people go in and just never seem to come out with a good solid answer. And some of it is that there are just so many different ways that a person might describe their symptoms, and how a person describes their symptoms or where they think it's coming from will lead them down a path of who they potentially talk to first. So if it's a female who's having pain very low in the abdomen, almost always their first course might be to go talk to their OBGYN, and their OBGYN might do an ultrasound to see if there's something going on with the ovaries or the uterus or that. And if something's not found in that situation, then, kind of get the green light, but the person's still dealing with their pain.
You're listening to the St. Louis Pain Expert Podcast with Dr. Dave Candy, St. Louis's leading expert in chronic pain relief. Dr. Candy specializes in helping women age 40 and above to overcome chronic nagging aches and pains without medication, injections, or surgery, so they can stay active, mobile, healthy, and independent. Whether you're suffering from pain yourself or know someone who is, pain's a universal experience that affects us all, but that doesn't mean you have to suffer. Knowledge is power, and having the right information can help you or someone you love get on the road to recovery. On the St. Louis Pain Expert Podcast, Dr. Candy talks with other pain experts from around the world to give you the information you need to recover, the peace of mind of knowing that you're not alone, and the hope that lasting relief from chronic pain is possible, and it doesn't require relying on pills, injections, or surgery in order to do so. So sit back, relax, and open your ears, mind, and heart, and let the healing begin.
Welcome to the St. Louis Pain Expert Podcast. I'm your host, Dr. Dave Candy. I'm here with Dr. Brooke Kalisiak today, and she is a women's health physical therapist. The last couple weeks we've been talking to physical therapists and pain experts from around the country and also in Canada, but Dr. Brooke is also here from St. Louis, so I'm going to let her introduce herself and tell you a little bit about what she does.
Oh, thanks for having me on the podcast, Dave. I really appreciate it. So, I am a board-certified women's health physical therapist, which means that I specialize in working with women and men. So the name's a little bit of a misnomer, but women and men who have different pelvic conditions. So this can be anything from bladder issues, bowel issues, pelvic pain, pain with intercourse, to women who are dealing with pregnancy and postpartum issues, even all the way down to kids who have bladder or bowel issues. So I spend a lot of time helping people out with the midsection of their body and making sure that things are working well that way. And a big portion of my patient population is people who are dealing with different types of pelvic pain scenarios, whether it be a chronic pelvic pain or more acute things, but there can be many different reasons that we're dealing with pelvic pain. And I really feel like it is a population that unfortunately gets passed around the medical system and really doesn't get a lot of answers, or it takes a long time for these people to get answered for why they're having pain. So it's really in my mission to get information out there for people that there are multiple different causes for pelvic pain, and there are things, lots of times very conservative things that they can do to help get themselves out of this pain and get answers to their questions and their issues much faster than it usually takes.
Yeah, that is a kind of well-kept secret in the medical community. I know before I got into the field, actually, I didn't know that it exists. Mm-hmm. Can you kind of describe the journey that your typical patient goes through in their kind of leading up to actually being able to find you?
Yeah, I like to unfortunately refer to the problems going on in the pelvic area as kind of the medical black box, because people go in and just never seem to come out with a good solid answer. And some of it is that there are just so many different ways that a person might describe their symptoms, and how a person describes their symptoms or where they think it's coming from will lead them down a path of who they potentially talk to first. So if it's a female who's having pain very low in the abdomen, almost always their first course might be to go talk to their OBGYN, and their OBGYN might do an ultrasound to see if there's something going on with the ovaries or the uterus or that. And if something's not found in that situation, then, kind of get the green light, but the person's still dealing with their pain. And so they're like, well, maybe it's more on the GI side of things. I've got to go see a gastroenterologist now and see if there's something going on there. And then that might lead to them to having a colonoscopy or another invasive test to see. And it's like, well, your GI tract is looking great. It's not coming from there. And, potentially then they have a friend who says, oh, that's when I had some pain in that same area, and that was my hip. And that, so I know a great hip doctor. You should go see this orthopedic guy who specializes in the hip. They do x-rays of the hip and maybe an MRI. And now all this testing is just adding up and adding up and adding up. And at no point in time are the people getting a good answer to their question. They're getting lots of negative testing, ruling stuff out. But what ends up happening is they still are dealing with the pain. And at no point in time did anyone necessarily look at the musculoskeletal aspect of what's going on. So looking at the pelvic floor, looking at the lower abdominal muscles and how everything's coordinating together. Because although those may not be the main source of the person's pain, especially when it becomes chronic in nature, the musculoskeletal component of it can be a big player in why this pain is continuing and furthering along and becoming chronic. So I oftentimes, unfortunately, get patients who end up in my office by strictly the referral of their friend who has listened to their story that they've gone to 4 or 5, 6, sometimes 7 or 8 other providers, and no one's been able to identify their pain. And we do a musculoskeletal exam looking at everything in and around the pelvic area and the pelvic floor muscles. And sometimes it's as simple as, I can get my finger onto the pelvic floor muscles and, I call it lighten them up like a Christmas tree. And they're like, that's my pain. Like, that's it. Like, that's what I've been feeling this whole time. No one's ever found it. You're the first person to kind of figure it out. And these patients, they're both really relieved that we've found something and it's musculoskeletal and we can do something about it. And oftentimes they're really angry because sometimes it's years that they've been dealing with this and they've spent thousands of dollars and are going around the medical system trying to get answers and have done invasive testing and, haven't got any answers to it until they got to a pelvic physical therapist.
Yeah, I see things like that a lot as well, that, sometimes the problem is very simple. It's just you haven't gotten to the right person yet. Mm-hmm. And I can imagine that, even the types of musculoskeletal pain that I see, it probably gets magnified even a lot more in such an intimate area like the pelvis where, it affects your everyday functions, the way
yes.
you have use the restroom, intercourse, all kinds of private things that for the most part, people don't really like to talk about a whole lot.
It is very true. It is very true. And a lot of times I feel like people don't realize how intermixed these things are in the rest of how our body moves and the rest of how our body works together. I think as a society, like you said, we don't like to talk about the pelvic area and we kind of put it aside as its own little separate thing. And so I have lots of women who get referred to me because they're dealing with bladder leakage issues. And so they've gone to see a urologist and the urologist says, oh, you need pelvic floor strengthening. Go see a pelvic floor physical therapist. And I'm working with them and we start talking and they also start telling me about their back pain and their hip pain and their knee pain that they're dealing with. And, it ends up being that they don't have a good core support system around their midsection, around the pelvic area, and it's affecting all of these different joints and areas. And I got to see them because it got so specific to the point that it was bladder leakage, but it's really kind of a poorly functioning core support system that ends up causing all of these various problems. But yet the patient doesn't necessarily link all those together. They think, whether it's from past experiences or that, oh, I'm going to see a pelvic physical therapist. What are they going to do? They're going to teach me some Kegel exercises and, that's it. And they're very surprised to learn that we're looking at their whole body, how they're moving, what they're feeling in their hips, their back, all the way up into their neck and shoulders, and seeing if they can coordinate together things with their abdominal muscles and their pelvic floor, because all of that interrelates. And I've even had it where people have been seeing other practitioners for their back pain or their hip pain, and then they get referred to me again for maybe a bladder issue. And, I just politely say, you might notice a difference with your hip and your back symptoms with what we're doing here, because, we can't think of the pelvic floor as its own separate thing. It's the bottom of our core support system, and it has to coordinate together with all these other things. So if we're not looking at it all together, we're not going to get the most optimal effects. And that's where some people have had trouble or gone wrong with previous rehab attempts or previous working with previous practitioners, because the pelvic floor component of it gets ignored and we're not looking at it as a whole. And that can be kind of a good tidbit or a tip for people who, if they are dealing with lower back, hip, pelvic symptoms that don't seem to be going away, and no one's talked to them about their pelvic floor and their bowel and bladder function and how that all works together, then we're probably missing a piece of the picture. And that may be what they need to kind of finally heal all the way.
Yeah, you're never treating, it seems like with chronic pain, you're never treating just one part. It's always kind of a whole person approach.
Definitely.
Now, you mentioned that you were a women's health, board certified women's health specialist. Can you tell me a little bit more about the process that someone has to go through to get that, and how that allows you to help people?
Yeah, so when you come out of PT school or physical therapy school, it really depends on where you went to school, if you got any type of education in women's health and pelvic health. So that's kind of up to each school itself. So once you know that that's an area of physical therapy that you want to specialize in, our national organization has different training courses that you can go on to further your education and show your specialization in it. And so you do coursework, you submit a case study, and then you take a standardized test to, just like becoming board certified, in any other kind of field, you have to kind of show your expertise with it, so that you can really know that you've kind of honed down into that area. If I'm dealing with a heart issue, I'm not going to go see a doctor who is an orthopedic who specializes in hip issues, and that I want to go to a cardiologist. And the same thing kind of goes in the physical therapy world. We have specialists like pediatric specialists or, women's health specialists or orthopedic specialists. It's showing your area of expertise that, this is my passion area and where I really spend the majority of my focus. That being said, I think you can focus too far down onto just the pelvis. And I really start all of my examinations with patients looking at them as a whole, and how does what they're feeling in the pelvic area contribute to how everything's moving and working together. And if we just focus solely in on just the pelvic floor muscles and what are they doing, you're missing the big picture and how everything has to work together.
Now, can you describe some common complaints that might cue someone off that, maybe they do need to consult you, or if they're not in St. Louis, someone who has similar training to you?
Yeah, so a lot of times when pelvic pain is a kind of catch-all diagnosis for any type of pain that happens below the belly button and above the thighs, and because that's the area that encompasses the pelvis. Common symptoms that I find a lot of people complaining of are, one is tailbone pain. So it's pain specifically at the site of the tailbone, and that can be very acute in nature. It's been going on chronically. It's only when you're sitting or only when you're doing certain movements, but that one almost always has some type of musculoskeletal cause to it, and should be evaluated by a pelvic physical therapist. And Another common pain situation that I see all the time, especially this one's more in females than in males, but is kind of lower abdominal quadrant pain. So real low down in the pelvis, off to one side, and almost always, if it's a female, they're like, I think something's going on with my ovaries. That it just, then they point right to about where the ovaries are. And these are the people that usually end up at their OB's office with an ultrasound and everything shows up okay. But there is a muscle called our obturator internus muscle that is deep in the front of our pelvis that can send pain up into that area. And it is often a compromised muscle, especially in females with our wider pelvises, that can be problematic for people. And so figuring that out, if you're having that right or left lower quadrant pain in the abdominal area that's not getting better, or that, and it especially seems like it changes or tweaks with different movements, then that's a time to definitely check out with a pelvic physical therapist to kind of see what's going on with it that way. What else? More specifically, anytime you're having pain with intercourse, especially if that's gone on for a little while, I've way too many patients who have told their doctors about it, or doctors have potentially examined things, found nothing wrong, and unfortunately told these people that their pain's all in their head, or you just need more lubricant, or drink more and that'll make it better. And these people then think that something's wrong with them, but don't necessarily ever seek out the help that they need and deserve. And a lot of times there is a musculoskeletal component specifically of the pelvic floor muscles that's contributing to their pain with intercourse. And if they can get in to see a pelvic physical therapist for that, they can make a significant impact on their relationship, on their sex life, on their pain level. And, it's very much, real pain that's there. And, to hear people be told that it's all in their head just makes me kind of really sad that that's actual advice that's been given to people.
Yeah, that's unfortunate. That happens a lot in, the chronic pain patients that I see as well. And I can imagine when it affects like your pelvic area, there's got to be a lot of psychological consequences to that, either depression or just wondering, hey, am I crazy?
Mm-hmm. No, it can affect all aspects, from mental, psychological, social. A lot of people start to withdraw from various activities emotionally and physically. And then, a lot of chronic pain patients have trouble sitting for any length of time, or they can only sit on very specific chairs or cushions and so they don't want to deal with the embarrassment of bringing their cushion with them out to dinner, and or wondering if they're going to be able to sit for any length of time, or is their friend's couch going to be too squishy and they can't won't be able to tolerate that. So a lot of people with pelvic pain conditions start to withdraw from activities that they used to like. And oftentimes when you're dealing with pelvic pain issues, you may also be dealing with underlying bowel or bladder issues. And so the stigma that goes along with that as to if you're always feeling like you have to be in the bathroom, or you're dealing with leakage issues and wondering if you're going to be able to make it in time. So there's a lot of stigma that can go along with it, and a lot of isolation. And I spend a lot of time with my patients assuring them that what they're experiencing, one, is real, and two, although it's not normal, it's more common than they think. Going back to what we said earlier, that people don't talk about this area that much. It's not, you're not at a dinner party and saying, oh yeah, well, I'm having some pain with sex, and it's just been a little rough for the wife and I. That conversation isn't happening in a social setting, but assuring my patients that they are not the only one who are experiencing this, and that I've worked with lots of other patients who have had similar symptoms and have been able to get over them. Just that reassurance that they're not alone is huge for a lot of people, because unfortunately too, because I don't think a lot of people in the medical community do justice to pelvic pain, they kind of push them along to the next provider. And so these patients haven't potentially gotten any reassurance along the way that their symptoms are something that are real and valid and that other people feel. They just feel like they're being passed along. And so it can be a very isolating experience.
Now, like you said, pelvic or women's health specialists are kind of unknown, but of people who actually do know of them, with that being kind of an intimate thing, what would you say to someone who maybe knows that that you or people like you exist, but would be a little bit hesitant to come for a visit, not really knowing what would happen that first day?
No, honestly, that's something that we hear commonly at our practice, that, that maybe they were told about it, or I've had people who have been told by their physician to come see us like every year at their annual appointment for several years. And then they finally got up the nerve to do it because their symptoms have gotten bad enough for that. But what I try to reassure people is that, especially at our office, but if the pelvic physical therapist is at all any good, they should be able to speak with you ahead of time on the phone, or let you come in and talk with them and get to see the practice and get to know the place and get your questions answered before there's any type of moving forward. Nothing is ever forced. So a lot of people are scared at the idea of it because the thought is like, oh my goodness, I'm going to have to endure a pelvic exam. They're going to potentially, it's similar to a gynecological exam. They're going to have to insert a finger into my vaginal canal. I'm too embarrassed about that, or that's going to hurt too much. Like I can't handle that. And honestly, my answer to that is that no, that's not necessarily the case. There's lots that can be done externally and just with tips and education to help you get to a point where you feel more comfortable being able to tolerate vaginal insertion if that's the problem that you're dealing with. So although the gold standard for assessing the pelvic floor is similar to a gynecological examination, that's not the end all be all, and there's lots that can be figured out and understood just simply by meeting with a pelvic physical therapist and talking about your symptoms and figuring out the best path to move forward for you. So meeting you where you are at and how can you move forward from there.
Yeah, knowing you personally, as well as many other pelvic floor physical therapists that I've known in the past, very rarely is an internal exam ever done on the first meeting.
No. Yeah, it's definitely, it can be a daunting experience for people, and it really, you've got to be able to make a person feel comfortable, because a lot of times, especially in a pelvic pain situation, pain can be the result of a spasming or a fear response to what's going on. And so to kind of force that situation where, again, we're bringing up fear and potentially causing more tension and more of a response, only kind of perpetuates what's already going on with it. And I've had people who have gone to pelvic physical therapy with other places and haven't had results. And I ask them to tell me about what they've done, and they're like, well, it was awful. I just had to grin and bear it. They told me it was going to hurt really bad, and I just have to. But eventually, it would feel better. And I'm like, whoa, we got to take a step back from that. This isn't forced through the pain. Like we got to figure out how your body is going to respond and work with it, not against it.
Well, I can definitely vouch for your work, being that you are in St. Louis, and we've shared a couple patients in the past, and everyone that I've heard has had nothing but positive feedback to say about you.
Well, thank you.
So if there's someone listening to this that, potentially thinks they need to get in touch with you, what would be the best way to contact you?
Yeah, the easiest is to reach out to us at our office, and our phone number there is 636-225-3649, and it's Legacy Physical Therapy. And we also know that people have a lot of questions about what might be going on with them, and so we tried to make our website as informative as possible with lots of downloadable information for people ahead that they can look at ahead of time. And so that may be the best place to start, that our website is legacytherapystl.com. And we have a whole section on there on pelvic pain and various other pelvic conditions where people can kind of get some information and learn a little bit more about how we may be able to help them out.
Well, thank you so much for taking the time to be with us today, Brooke. Enjoyed having you on the show, and just any final thoughts that you want to give people before you go?
My last tidbit of a tip for people would be, especially as it comes to pelvic pain, you may have to be your own best advocate. That if you are not happy with the options that are presented to you by a provider that you've sought care from, you're not stuck with that provider. Please continue to advocate for yourself and search around for another provider to help you out with your pain, because your pain is real and there are things you can do about it. So I don't want people left feeling like there is no hope in that, but it definitely can be more of a road that you do have to continue to advocate for yourself.
Okay. Well, thanks again, Brooke, and I hope you enjoy the rest of your day.
Thank you for having me.
You're welcome.
Thanks for listening to the St. Louis Pain Expert Podcast. We hope you've enjoyed the show. If you live in the St. Louis area and would like Dr. Candy's help to find a solution to your pain, visit our website at stlpainexpert.com. Email Dr. Candy at dave@stlpainexpert.com or call Dr. Candy's clinical practice, Movement for Life, at 314-941-3970. Movement for Life offers free consultations called discovery visits to people who are serious about discovering how they can relieve their pain and get back to the happy, healthy, and active lifestyle they deserve. If you're listening from outside the St. Louis area but would still like some help, feel free to contact us to learn more about our virtual health coaching. Regardless of where you live, please share our podcast with anyone you know who would benefit from learning more about pain and what can be done to relieve it. And don't forget to subscribe to our podcast on iTunes, Google, Spotify, or your other favorite podcast platform so you get notified when we release a new episode. Thanks again for listening, and we hope you'll enjoy us again soon.